This project is titled Leadership and Communication Improvements in Orthopedic Surgery Operating Room Timeout Huddles. In terms of our introduction, first it's important to understand what timeout huddles are and their importance. So when surgery started to occur, that we didn't have timeout huddles. It's a relatively new practice in terms of the lifespan of the operating room and surgery as a whole, but we found that by adding timeout huddles where each member agreed on specific things such as the name of the patient, the birth date, to identify that this is in fact the correct patient, the correct operation being done, making sure that it isn't a wrong site operation, confirming the patient's allergies, medications, possible negative responses to any treatment given, etc., etc., we could significantly improve the success rates of the surgery and decrease complications. So these timeout huddles at the beginning and end of the operation became very standard practice, especially in these high-stakes surgeries. However, this also created an interesting dynamic where even though everyone was shared equal responsibility for a negative event happening, the specific blame could be passed around, and the culture of safety may or may not have necessarily been created depending on the specific society or the specific culture of any individual hospital. So our goal was to try to find out whether or not each of the members on the team, those being the anesthesiologists, medical students if applicable, nurses, orthopedic surgeons, technicians, they felt as if they were valued in the decision-making process, as well as if they were to suggest any means of improvement. In terms of our methodology, we sent out surveys across the United States, so their generalizability is limited to the United States. We sent them to active members in the ortho operating room and asked them to first verify their position with identification and also then express how they felt in terms of a scale of 1 to 10, 1 being not valued at all and 10 being extremely valued. So in our study, we had 30 orthopedic surgeons, 41 anesthesiologists, 66 nurses, 59 medical students, and 79 technicians, and our response rate was about 78%. So first, in terms of results, we'll discuss the anesthesiologists. They had a average response of 8.44 out of 10. Medical students had the lowest by far, which was a 5.56 out of 10. The nurses had a rate of about 8.52 above the anesthesiologists. The orthopedic surgeons had the highest rate of 9.87, near perfect score, and then the technicians had a score of 8.8, which was the second highest response. So in terms of our conclusion, we showed that there was a significant difference with a p-value of less than 0.05 between the response rates of different fields. So there is the field that one practices is associated with their average response rate in the response score in terms of the amount of them feeling valued in this timeout huddle. So the three significantly different professions are high, medium, and then low. The high level was among orthopedic surgeons. We propose that this is because of the fact that they are typically considered the leader of the operating room in general practice and therefore stereotypically have a lot of control. The middle group included the anesthesiologists, nurses, and technicians. And then the lowest group was the medical students. We found this somewhat concerning because the medical students are the future of healthcare. Might be biased speaking as a medical student here, but we felt like it was important for them to feel valued as well, especially because preventing a surgical site infection or some kind of miscommunication in the allergies or the incorrect patient, these are certain aspects that are not specific to any career. It doesn't matter who points them out. At the end of the day, the outcome is the same. The patient's life is benefited. So we hope to continue further studies and figure out if we can elevate these numbers in any way. Thank you for listening.